Good morning, I'm Dr. Reynolds, Bill Reynolds. I'm a plastic and reconstructive surgeon here in Springfield, Missouri. Our website is receiving a lot of requests for information regarding a mommy makeover. We thought we'd just do this short video to give you some ideas about what a mommy makeover is and some of the considerations that plastic and reconstructive surgeons use in determining whether one is a good candidate for a mommy makeover. Now, mommy makeovers are getting more and more attention in the press throughout this country. Women who've had babies and have their breasts dropping and having loose and lax skin of the lower abdomen and muscles are interested in mommy makeovers, and this is perfectly reasonable. This is a procedure that is a very long procedure. It combines both a breast augmentation and or lift and a abdominoplasty, which is also known more commonly as a tummy tuck. Now, doing them both at the same time takes a little longer than doing one individually, and there are certain increased risks associated with it, but these risks are manageable. The number one risk that people are concerned about is the formation of what is called a DVT, deep vein thrombosis, DVT. The reason these are important is that sometimes these clots that form in the lower leg can break off and travel back towards the heart and pumped into the lungs after it exits the right side of the heart. This is called a pulmonary embolus. They can be rather severe, leading to death, or they can be mild. But the whole point of this is to prevent them from ever happening. The way this is done in the operating room is on all procedures we use sequential compression stockings, which are placed in the lower legs and sequentially compress the muscles of the lower leg, which help advance the blood back through the venous system towards the abdomen and eventually into the chest and into the heart. If the blood does not stay in one spot for a long period of time, it cannot form a blood vessel. This is the thinking. Since sequential compression stockings have been used, the DVTs, they can occur, but they're much less frequent. The other concern that people have with longer procedures is the increased risk of infections. Now, infections are usually related to how long someone is in the operating room. There are other factors involved, but actually the length of time that someone's under anesthesia with an open wound during the procedure, the greater the likelihood of getting an infection. Wounds that are created with short procedures like carpal tunnel surgeries or Decker-Vein's disease, we just don't see infections with them because everything is done under sterile technique. However, the longer a procedure takes, the greater likelihood there is an infection. Also involved with all this is the risk of anesthesia. Now, the American Society of Anesthesiologists have given us a rough grading system of the risk factors associated with individuals. It's called ASA. It's graded on levels of 1 through 5. A 1 is for someone who is basically very healthy. A 2 is for someone who has some systemic illness but basically is okay. A 3 is someone with significant medical illnesses but can be life-threatening, but they are not considered incapacitating. Think of somebody who has chronic obstructive pulmonary disease or uncontrolled diabetes. Imagine somebody who is an uncontrolled diabetic, had recent placement of coronary catheter stents, and has a moderate to severe COPD, chronic obstructive pulmonary disease, or emphysema. This person is at risk for more complications. So if such a person were coming in and asking for a mommy makeover, it would be much more likely to persuade them not to have this. A 4 and 5 are for people who are very, very sick and are expectant. Overall, the data in the American Society of Plastic Surgery's journal seems to suggest that mommy makeovers can be done safely, but again, it all falls back to the physician and the patient. The physician must choose the patient who is qualified for having these procedures done and is fully aware of all the risks and benefits of it. The benefits are numerous, as are the risks. Thank you for listening.